Good evening. Welcome to Health Quest. I'm your host for tonight, as always, and we are here with an excellent show for you. We have Dr. Thomas Bain, who is a chiropractor and holistic doctor, and I have actually been treated by Dr. Bain. Hence, he's here on the show to share with us some very vital information, especially for us women, but for all sexes, or both sexes, I should say. We have some really great information tonight to talk to you about preventive screening and methods that are non-invasive, non-intrusive, and they're for your own good. So this is a very exciting show. Please don't turn your dial, and let us welcome Dr. Bain to the show. Thank you, Dr. Bain, for being here.
Thank you for having me.
It's great having you. I know you just got back from vacation, so it's been a whirlwind. But before we begin to go into the details of what it is you offer at your clinic and what you do personally and what your philosophies are, tell us a little bit about yourself, your background.
I'm a classically trained chiropractor. I graduated from the National College in Lombard, Illinois. And upon graduation, I spent 1 year in Chicago working. And I then went to Europe and started to just kind of absorb myself in the whole natural medicine field. I worked, I had 2 clinics in Europe, and I spent a lot of time studying with different doctors of natural medicine, doctors who used homeopathy, herbal medicine,
what a great
vitamin therapies.
Experience
Yeah,
for you.
a lot of different things. So I was exposed to different techniques of diagnosis as well as different techniques of therapies.
And
So
Europe is quite advanced in comparison to us in that respect, are they not?
they're just open-minded. You still get doctors who present with, you know, as an antibiotic is the answer to everything. You still get doctors with the same typical, what is considered the American presentation, allopathic. But there you will also find a doctor who will treat an ear infection first with homeopathic medications and will lecture or will discuss the importance of diet with the patients and lifestyle modifications and things like that. So really what is different about it is that there's the different choices are there for you. Whereas here, they're just hard to find.
Right.
So.
Well, especially in the Midwest.
Right.
I think more so in the Midwest. It's
Right.
harder. There's most of our allopathically trained, less conservative, moved into the non-allopathic approach tend to be more on the East or the West Coast.
Exactly.
In America. So we're glad to have you here.
And I'm glad to be here.
And we love the experience that you have, which you're going to share with us too. So what makes your approach to healing people unique in your estimation?
Well, there's a couple of different things. First of all, the forms of diagnostics that I use are pretty unique. They're not available really. At least I don't know of too many people in the area that are using the forms of diagnosis that I use. That's the first thing. I'll get into that in a little bit. But also the treatment approach is unique also, because a lot of people give lip service to the mind, body, spirit approach, but we actually have techniques in place that really address
Embrace
each
them all.
one
Right.
of those, you know, addressing or diagnosing organ system dysfunction. And once you see which organ system is dysfunctional, is that organ system dysfunctional because of a physical stress? Is it dysfunctional because of a chemical stress? Or is it dysfunctional because of an emotional stress? And the treatment modalities go into assessing which of the 3 components it might be. Diagnostically, we pretty much use what is considered German biological medicine. So we use computer-regulated thermography, and we use dark field microscopy, and then we use some of the more advanced kinesiological techniques, total body modification, neuro-emotional technique, some things like those.
And we'll get into this in a little bit, because it sounds like, what's that?
Right.
If you haven't been exposed to it, and many people have not, or
Right.
people have been exposed to one but not the other.
Exactly.
So the reason I actually found Dr. Bain was a gift. I'm sure God was looking out for me, but many of our viewing audience knows that last year I had a breast cancer scare and was told by many doctors that I had breast cancer. And I don't believe in mammograms on a steady basis at all. I've had 2 in my life, and I'm 49 years old. So I went for the mammogram, and they actually did like 6 mammograms in one day, you know, which was very, very intrusive, and it really distressed me to have to do that. And I had heard through Erin, who is my yoga teacher, about you.
Right.
And she said that you did the thermal digital imagery, which I had read about as being a very good non-invasive technique or diagnostic tool that can actually detect heat changes or heat censoring changes in the breast tissue. Is that correct?
Very correct. Yeah.
A good 2 to 3 years before a mammogram will ever pick the
Right.
problem up.
Right.
Plus the radiation from a mammogram, from what I've read and studied.
Right.
In 4 years, if you take 4 mammograms 4 years in a row, that amount of radiation is enough to give you aberrant changes on a cellular
Correct.
level in
Not
the
only
breast
that,
tissue.
there's it's a small percentage of people. They say somewhere between 1 and 2% of women who seem to have a predisposition or a sensitivity to the even low doses of radiation 1 or 2 times. And the statistics
That's
show
so scary.
it is, because statistically it shows that there's 180,000 women a year in the world who contract breast cancer as a result of the very diagnostics that are supposed to be
There's
searching for it.
180,000.
Statistically, that's what they say. They
Women
say it's
a year.
between 1 and 2%
Because of the exposure
of
to the
every woman,
mammograms.
because of the radiation. Yes, that they have some type of a genetic sensitivity to even very low doses of radiation.
Well, even if you don't have a genetic sensitivity, it
True.
could be that just because of total toxic body burdens,
Exactly.
you're just at the watermark.
Right.
One
Well,
more thing knocks you over.
We tend to, especially for purposes of like a television show or something, we tend to focus on 1 or 2 things for purposes of explaining, but rarely is it one thing. You know, it's usually different things that have
Factors.
somehow come together and presented with the person that's sitting in front of you. So,
Right. So talk to us about thermography. How does it work?
Okay.
Where did it originate?
like I said, most of the education I've had is this German biological medicine, and the thermography that I use is computer-regulated thermography. There's also I can't remember the other name of the thermography, but it's a camera. It's a photographic thermography.
It shows heat.
That shows heat
images.
patterns, yeah, and that's a very viable form of thermography, and it's very good for certain musculoskeletal problems and things like that. But
So
for
it shows more inflammatory
more
issues?
inflammation, right? And but in the essence of what I do, that was not interesting for me because, and as I'll get into it later when we get off the breast component of this, but the thermography that I use offers so much more information. I mean, it
Right.
does offer breast cancer, but within breast cancer or breast disease, it's the manifestation is in the breast,
Right.
but it's not a problem with the breast
what
itself.
what I experienced when I did it with you,
Right.
Dr. Bain, was that it shows you where the origin or the number of origins of the problem originate. So
Exactly.
it tells you
The
where the
focus.
missing link is and what
Right.
is
And
starting
what
to
it
go
is.
amok. you know.
Exactly.
Yeah.
Well, what you do is you go into the room, as you know, I'll just explain, but you go into the room, and the room's between 68 and 72 degrees. And what we do is we have the woman, or a man, I mean, it is for a man, but we don't examine the breasts on a man because there's no clinical relevance to examining the breast on a man. But we have the person go in gowned, and their underwear remains on, but they take their bra off. And we scan points with a thermocoupling unit. We scan points on their face and their neck, their upper chest.
It's like a wand.
Yeah,
that
it's
he
like it's really just like a big
touches
pen,
you with,
know,
right.
and then across your abdominal area and your back, and then specific points on each breast. Then have you remove the gown and sit in the room exposed to the cold air for 10 minutes. And we do that without the presence of a loved one
Why
or
is
anything.
that?
Well, because, you know, what if that person just happens
No,
to
no.
make a comment
Why
or
is
something?
it cold?
Oh, why is it cold? Oh, it's cold because this is the controlled stress. So in medicine, there's 2 kinds of stress that test function. And one would be a exercise EKG. So when they're testing the heart and they want to stress the heart and see how it responds to the stress, they throw the person up on a treadmill and to check how the heart responds to the stress. And also a fasting blood glucose test is also similar in that it checks your sugar levels having not eaten, and then dumps a bunch of sugar into your body to see how your body responds to that. Those are functional evaluations of the function of the pancreas and the heart in this instance. Well, the cold air represents our controlled stress. There's a predictable change that should occur in the body. Points in the face and head, and especially points associated with your teeth, should slightly warm in response to the cold air. points on your body, with exception of the thyroid, should slightly cool. The thyroid should actually warm a little bit. Any change that occurs that's different from the predictable change gives us a sense of dysfunction in that particular organ system. So for example, if an organ system is supposed to cool, we'll just say the liver is supposed to cool, and it overcools, it becomes very cold in response to the cold air. That's typically a sign of allergy or toxicity. The computer can't tell the difference between the two. That's up to the physician to tell that. But that's some type of stress along those lines. Whereas if it warms instead of cooling, that's a sign of inflammation. So I use kinesiology. I've always used kinesiology. That's really the bread and butter of what I do.
What is kinesiology?
Kinesiology is muscle testing.
Okay.
So you use muscle testing and you test a reflex. If the muscle goes weak, there's a problem with the reflex. The problem is if there's inflammation in an organ, you wouldn't use the same homeopathics, nutrients, herbals that you would if that organ system, that same organ system, was toxic or allergic. So a lot of times what you're doing is using intuition and using your clinical experience and things like that. And that's great. And a lot of doctors out there get good results that way. But with the thermography, we just, boom, it's there.
It points it right out, and it
right
tells you
there.
what to use.
Exactly.
Right?
So like with inflammation, you'd use like drainage remedies, homeopathic drainage remedies, low dose homeopathics to pull heat from.
Does the breast tissue warm up?
Well, the breast tissue is supposed to cool slightly. As the points come closer to the nipple, they're supposed to really get cold because the nipple's extended away from the skin, so it cools much faster. That's what you would see on a normal breast thermogram. If there is an infection or if there is lymphatic congestion, that will show as an abnormal heating pattern. Warming instead of cooling, or a rigid reading, which means that the temperature doesn't change. It's exactly the same. That's actually the worst kind of reading you can see. That means that the nervous system is being overridden by some type of process. The essence of thermography was that a tumor, for it to be cancer, it must have its own blood supply.
Right.
So if a tumor starts to cool down, it doesn't want to cool down, it just signals send more blood to me, and I'll stay warm and comfortable. Right. So knowing that it should cool, if we see a warming pattern or a pattern that's abnormal in a certain area, then there's other points that we look at in the body.
That would be related.
That would be related. It's actually not unusual at all for there to be dysfunction in the breast. I would say 80% of the women that come in have some form of dysfunction in the breast.
You mean more so in the lymphatic
Exactly.
tissue?
It's as a result of lymphatic congestion, improper water consumption, not drinking enough water, poor aerobic exercise, improper protein metabolism, things like that.
Which brings me to, this is why my daughter bought me a little mini trampoline for Christmas, because Dr. Bain was like, you've got some congestion going on. And I was like, I know I do. So now I'm bouncing away.
Right, which is a great form of, I mean, really anyone over 30, any woman over 35 years of age, it's a great lymphatic drainage. You know, there's lots of massaging techniques and things like that that help too. Right, but the essence is that, you know, you say, well, this is, you know, it's not pre-cancerous, but this is pre-degenerative changes in your breast. You have clogged lymphatic vessels. And I think that's what was really being picked up with you when you had your testing.
Month. But tell women out there too, you know, why that is. You know, what percentage of our lymphatics are surrounding our breast tissue?
It's all it is.
40% of your
It's
lymphatic
really
glands are up
all
here, right?
It is, right, exactly. And the other part too is that, again, because the breasts extend from the body, the circulation isn't as good there, and that's why there's more lymphatic channels, so that they can drain the poisons and everything that are coming from the chest and the head, so that can be drained out, sent to your intestines, so that your body can eliminate it.
So Dr. Bain, I have a quick question for you. In your opinion, do you believe the rise of breast cancer is a compilation of factors, or do you think it's in good part because of mammograms and the fact that people aren't drinking enough water, or it's not clean water, and or they're not exercising enough, and or they're just too stressed? I mean,
I'd never blame any one thing across the board. I think that there's always going to be an instance where, yeah, this one particular case was caused by poor lifestyle, or this was caused by poor genetics, or this was caused by diagnostic procedures that put stress on the body. So, but across the board, I think that what we're experiencing, unfortunately, industrialization has caused us to have an increase in toxicity in our environment.
Right.
And then lifestyles of convenience. You know, eating foods that are prepackaged and they're dead foods, right? It causes chemical imbalances in the body which predispose the body to degenerative changes. Not necessarily cancer, cancer being an end stage. When you look at blood under a microscope and you watch how blood evolves through a disease process, and you see the role that funguses and bacteria and viruses play in disease processes, you start to, you know, you can almost become obsessed about it a little bit.
It's kind of gross.
Right, but when you look at this, you're like, where did this all begin? Well, this all began with dysfunction in the digestive system. Person was consuming entirely too much sugar. We don't have any real measurable way to digest refined sugar. Our body was not made to eat it. So this causes pancreatic stress. We start to digest less and less of our food, starts to cause stress in the intestines. You know, I've never met a woman who has breast problems that didn't also have intestinal problems. There's a huge correlation with that. So it's important for women to understand that the manifestation of the tumor is maybe in the breast, but the problem is systemic.
It started someplace else.
And usually in the gut. Not always, but and that's the problem, because then they go to their oncologist, and the oncologist is looking at the breasts. They say, well, the breasts look great, you know, and of course they look great, because that's the end stage of the problem. So
when you catch it, it's almost too late. That's when you're
by that point, you know,
that.
you should have been years before that. You should have been working on it.
So can the thermal imagery then detect these changes, as we said earlier, 2 to 3 years before it'll ever show up on a mammogram as some type of a dark spot or cyst?
Or the starts, the lymphatic changes, dysfunction in the hormonal systems, all these different things that are showing what the Germans refer to as the terrain that allows a tumor to be produced, or for a tumor to form. So the essence of the thermography 30 years ago when they invented it was they felt that there was a predictable pattern, a terrain that set the stage for a tumor to form. And the essence of preventative medicine being, let's predict that terrain, see that terrain before a tumor forms, reverse it,
clean it up,
prevent the tumor from ever coming. Or in the case of if a tumor is already there, identify the primary stresses in it that have caused it to form and start to reverse them.
Well, this is a wonderful gift that you bring to Chicago.
Yes.
Because I believe you are the only one I know of that does it in the area.
There is there's someone in St. Louis that's doing it now.
It's a long ways away from Chicago for
that's
people.
True. And there is
West Coast.
There's a lot of them on the West Coast. The company was very smart. They waited until they got FDA approval before they made it mass produced. My fortune was that I was exposed to the technology in its earlier stages in Germany. So
with extensive training, which makes the ability for you to do this process, I may add, very quick.
Right.
You're fast.
Well,
you're like boom, boom, boom.
Exactly.
And
it's not brain surgery. I mean, it is a talent, but when you sit in a room and you do that all day, you know, after a couple weeks, you get the hang of it. I've been doing it now for a couple years, so it just kind of rolls. And you know, you take into consideration the history of the patient. You know, it like any diagnostic, it is a tool. It's not the only thing I do. It is a very valuable tool, but in combining it with some of the other things that I do, it really makes it's a strong approach in my ability to say, look, this is what's going on with you, and it's subjective. It's the computer telling them. It's not me saying, well, this is what I think's happening.
And here's what we need to do. So, is it hard to get in to see you? Do people have to call and really schedule far in advance? I know you guys are busy.
Yeah, we're busy, and you know, we have a lot of fun. You know, we love going to work.
Treat for me. I actually went and took, I had all 3 practitioners do the mind, body, spirit on both myself and my daughter, and it was just marvelous.
Yeah.
As a practitioner who never really has things done to them other than
Right.
massage or acupuncture. It was wonderful to have 3
Exactly.
guiding, loving hands.
Exactly.
Just take me
And
put me
that's
through
the approach we try to
process.
do. We try to make it so that you know, the atmosphere of the practice is very relaxing, because people are going to wait, because I may have only booked 15 minutes with you, but on that particular day you may have needed a half hour of my time. So I'm going to give that to you, and as the patients go through, they realize that, you know, if I'm running late, it's because there were circumstances that dictated that. It's not that I'm, you know, off on the phone or playing in the back with, you know, games or anything. I'm working, and we have fun, and we're addressing so many of the different components of health that really are missing from medicine today. So once people get into the routine, you know, it's not unusual for someone on their first visit to be upset by the first time they come into the room, because they've been sitting in the waiting room for a half hour, 40 minutes waiting. But once they get the essence of it, then they learn, and you know, we take a multi-physician approach to it, because we're each gifted in different areas. You know, I tend to really look biochemically, whereas some of my partners tend to look more at emotional components. And we all do the same thing, but we all have different interests. And basically, it's not like there's a, you know, a year waiting list to get in. Basically, you just got to call, and the girls will set you up with an appointment and get you
And
in.
he has this really great fish tank in the waiting area. So if you're sitting there, you'll be like mesmerized by the time it's time to go in anyway. So tell us, what are the other benefits to thermography in your opinion?
Well, the reason I got the machine, I mean, I'm happy, and I'm honored to be able to provide a service for women that allows them to, at a minimum, decrease the amount of mammograms that they need in a lifetime. I feel honored to be able to do that.
Now, can I interject something
Yes.
here? Why would doctors prefer that women obtain mammograms, in your opinion, over doing,
Because they don't know anything else.
because they don't know about the thermal digital imagery?
That's my take on it. They just don't know anything else. They don't know about the research that's been done on thermography. They don't know about the non-invasive nature of it. They don't know these
So
things.
once again, women, you need to be your own advocate, and you need to find out. I mean, you have a ton of information on this
Right,
too.
exactly.
So, and it's on the internet. I think you have a
Yes.
website too, which we can share with you if you call me. But you need to be your own advocate, and you need to really, in my opinion, in a preventive stance, take care of yourself and seek out the information here that's going to benefit your health in the long term, and your kids and your grandchildren. I mean, you know, we're the nurturers of the world here, so you have to take care of yourself and make sure you don't put your body in a position of jeopardy.
Right.
But anyway, so
Well,
the benefits.
the benefit was, for me, was the organ system dysfunction. You know, to be able to see the pancreas, the intestines, all those other areas, because that's the essence of what I do. So in evaluating the stressful areas of the body in general, that to me was more clinically relevant than just examining the breasts.
So do you then, once you look at the organ system dysfunction, you go, okay, we've got 3 priorities here. We've got maybe 8 systems that need help, but these are the top 3 priorities, and we're going to work on those first, second, and third, and then we'll move to the next.
Yeah, I try to map out the three months at a time for people. So, you know, I start and I'll say, you know, your lymphatic system seems to be the primary issue. I'm going to start you on an eating program. I'm going to start you on an exercise program. I'm going to start you drinking your water, and we're going to use some lymphatic drainage therapies, for example. So we're going to do that, and we're going to use other botanicals or things like that to support digestion or whatever it might be. And we're going to do that for the first month. We're going to do this we're going to move to the next step the second month, and then the next step the third month. At the end of that third month, sometimes it's necessary to redo the thermography. I like to use it as once a year as a mammogram. And if a person comes in and there's a lot of things that are just, you know, everything's clean, they're really healthy, I'll say, you know what, I'll see you in 12 months. But a lot of times when there's these factors that are predisposing factors to degenerative change, I won't want to wait a year. I want to make sure, and it holds me accountable. You know, if I'm recommending a therapy and it doesn't work, I'm going to be held accountable for it, because 3 months later, hey, I still got lymphatic problems, I still got liver congestion. How come? You know, I'm doing what you told me to do. Why isn't it working?
Well, providing they're doing what you tell them to do.
Exactly, right. Usually it's that's the problem.
You know, people giving up lifestyle habits that are comfortable and conducive to, like, just, we call it the noogie approach.
Exactly.
You know? People like what they like. So, is
And-
dietary implementation the hardest thing to implement, in your opinion? Changes?
You know, I think everybody's different, because some people come in and they turn on a dime and they never look back. And then other people just struggle with it. And it's about your comfort level. Other people don't want to exercise. They'll eat exactly like you tell them, but they don't want to hear a thing about exercise. Changing your lifestyle, you know, if you're 40 years old and you've done things a certain way for 40 years, and then to be told, look, the reason you're sitting here across from me now is because you've been doing it this way and this is wrong. You've got to change. That's hard for a lot of people. People are, by nature, like to be in control. And they like to think that they're doing the right thing, no matter what it is. So to tell them that it's wrong and to say there's got to be changes to that, people have a hard time doing that.
Right. So you minimize it. You give them, like, I mean, sometimes what I do in my practice, which you could do as well, or you probably do, is I set up a year plan. I go every
Right.
month you do one thing. By the end of 12, you got a new body.
It's
you
true.
know?
I'm pretty hardcore with
Baby
people.
steps.
I do. I tell them, look, this is what you got to do. And
Well, and some people you have to be.
you have to. I really feel that it's a waste of their money, my time. Don't do it. If you're not here to make the changes, don't come.
Right.
Because I don't need people to come that kind of want to do this a little bit.
Right.
Do it or don't do it. And
This would also be really ideal for people who've had any other type of cancer as well.
exactly. And
You
it
know.
picks up disease processes, the
So it
diagnostics.
tells where
and-
you're going.
Exactly, where you are in this pattern. There have been women who've come after already having biopsy-confirmed breast cancer. And they say, what is my prognosis? Should do the thermography on me to let me know how realistic is this? Do I have a chance? You know, or is it so far gone that I don't have a chance? And really what I tell them before I even do the thermography is you always have a chance.
Where there's breath, there's
Yeah, so you've got to work on the mindset, you know, first with a lot of these women. But the changes that need to occur in the cancer patient are evident, and they're not always the same, even though the person might have a tumor in the right upper quadrant of their left breast. Two women with the same thing, but their issues in their body are completely different.
Sure.
The approach is completely different.
Which is marvelous.
Right.
Very individualized. Out of
Exactly.
time,
Right.
they've discussed.
Yeah.
If you have any questions about Imagery and you'd like more information about Dr. Bain and his clinic and the process that they offer and this preventive measure that you take to really decrease the risk of developing health problems, albeit cancer, then please give me a call. I'm happy to guide you and show you the way. So until next week, take very good care of your health. I'm Deborah Arneson, bringing you light and health. God bless. Good night.
Great.